Good afternoon and welcome to our webinar, LHC Reach Out. My name is Josie Gaitan and I work for Reach Out. It's a nonprofit organization in the Inland Empire. I would like to say to all our webinars, it's going to be in English today. And if you want to hear it in Spanish, you can dial the number that's in the invitation, or I can give it to you. Si necesitan traducción, por favor llamen al número 978-990-5180 y ahí en su invitación tiene el código 3126620 para que lo puedan escuchar en español. Okay. Today we'll be talking about flu shots and COVID-19. Why is it very important for us to get our immunizations for the flu shot at this time? So we are here today, and joining us will be Dr. Julian Britton, MD, Director of Emergency Medical Medicine at Kaiser Permanente, Fontana, Ontario Medical Center. Dr. Britton grew up as the youngest of 3 boys in Rowland Heights, California, and suburban community in Los Angeles County. He attended UCR for his BS in biology, undergraduate studies where he graduated from his BA Science. He then moved to Washington, D.C. and attended Howard. I am so nervous today because I'm having this amazing headache, but I apologize. So he attended Howard, and let me go back. University College in Medicine. After finishing his medical school, he started his postgraduate completed in medical training in emergency medicine at Florida Hospital Medical Center in Orlando. After medicine at Florida Hospital Medical Center in Orlando. After completing the medical training, he returned to Southern California to work as the emergency room doctor in Kaiser Permanente in Fontana and Ontario, where he has practiced emergency medicine for the last 5 years. We welcome Dr. Britton, and now I give the floor to Dr. Britton. Welcome, doctor, and the floor is all yours. Is he with us?
He hasn't logged on yet, Josie.
Oh, he said he was looking at us. He just didn't know how to turn the volume off. Why can't I see them? He's not on yet? Let me call him. Maybe he's having trouble getting on it. I really apologize for the inconvenience, and I tried to memorize every single thing and it didn't come out right from the doctor. Okay, let me call him again. He was just getting, he drove from the hospital to his house, so he was just getting there.
I saw something that it says, but my camera and sound isn't working. There is a message.
Well, do you want to just go ahead and talk? We can hear you.
Okay. Let me see if I can do it through my phone. It's not on my laptop, but
okay.
Give me
Okay.
1 second.
Okay. I'm going to hang up.
Okay.
He's trying to see if he can get to his phone. So Dr. Shapiro was going to be with us today. He is having a lot of emergencies at the hospital where he's at. So we don't know if he's going to be able to come in a little bit later. If he's able to do it, he'll just pop in. He said they've been really, really very, very loaded with work, and everybody's been in the emergency room. So that doesn't sound like we're getting any better. It just seems like it's getting worse. Dr. Britton, can you hear us? He's having trouble getting into the computer. Jesus, can you see him? I can't see none of you guys.
I cannot. What about you, Jesus?
I think he's in the attendees, but his microphone looks like it's on. I
Yeah,
think he's under Josie's name because that's where he sent the message. His microphone's on, but I don't know if he's talking through it or not.
he was trying to get in his phone because his camera wasn't working in his computer. So I don't know if he could hear us. Well,
Can we pull him out and put him as an organizer? Because it's kind of weird because I can see that he's under Jesse's name and it says organizer, but
Jesus, do you want to call him? I'll send you his phone. If you can call him for me, please, see if you can help him. Does anybody have any, ya te lo mandé, Jesus. I guess we can talk a little bit, since we're waiting for Doctor, we can talk a little bit of our CC PL. We are inviting everybody to come and join us and look at our website for our healing communities through Racial Justice. It is a very, very good program. It's for agencies, business, organizations that have never worked with racial justice and would like to attend to learn more how to implement it into your agency or organization, your business. We are hoping to have 2 to 3 people from each organization to come and learn on how to use all this.
Can you hear me?
Are you hearing him?
Hey.
Oh, hi. Well, welcome. We're waiting for you.
Okay, give me 1 second. I think, so you guys can hear me now?
Yeah, we can hear you now.
Okay, sorry. Okay. I think, you just called me on my regular phone, so that works.
Okay.
But I don't know why the video's not working.
Oh.
Okay.
Well, we can hear you.
You can hear me?
Yeah.
Okay, is there any feedback, or because I hear
I just
double?
I don't know why it's coming up. I just introduced you.
Okay.
So you're on the floor. The floor is all yours. And if you want to tell me a little bit more about yourself, I just introduced what you said to me. And
Okay, no problem.
so welcome and thank you for coming and joining us today. And the floor is all yours.
Okay, thank you for having me. My name is Justin Britton. I did grow up in Southern California, in the LA area called Rolling Heights, the youngest of 3. My dad was a real proponent for, education. He has his MBA. My oldest brother has a PhD. and my other brother was a social worker. So, you know, education and, you know, is pretty big in our family. But I grew up, I went to UC Riverside for undergrad, did biological science as my major, and then I moved to Washington, D.C., where I did medical school, and then a year of internal medicine, Baltimore, where you learn a lot, just general medicine, and then finished my ER training in Florida, Orlando. Then I moved back home, this area, you know, closer with family, where I've been practicing at Kaiser Permanente, San Bernardino County, at Fontana, Ontario Medical Centers for the last 5 years. So, I mean, this year, a lot has been going on with viruses. People know mainly the coronavirus, which has kind of changed the shape of how we do our normal day-to-day business and medicine, and how it's affected everybody's social economical status. A lot of questions are going to come around the next few months as coronavirus and the flu are both going to be, you know, emerging together, as we feel like we're trying to get a hold of coronavirus as the cases were going down. Now they're starting to peak in some areas. In addition, with the flu season coming, it's going to be a question to see what's going on, and, you know, just making sure people are safe and taking precaution is very important. Now everybody knows of the flu in general. Everybody's heard of it. You know, the influenza virus, you know, affects the respiratory system. Most people's immune system can generally handle it by itself, but it can be dangerous in certain populations. Being very ill, they have a lot of regular comorbidities. As you get, you know, in the older in age, being over 65, but they recommend everybody over 50, you know, actually get vaccinated. So in general, they say who's at risk: children under 5, especially those under 2, people over 65, people that we said have weakened immune systems and comorbidities. One of the bigger comorbidities being asthma, COPD, cystic fibrosis, any of the diseases that usually affect the lungs in general. People that have diabetes, type 1 and 2, also, and people that have heart disease. And we're not saying in general like high blood pressure, but if you've had like a heart attack, heart failure, any more of the more complicated heart diseases, that you probably at a higher increased risk of getting flu. Other people that are at more increased risk are people that work in medical facilities. So if you work at a rehab, you work at a hospital, a clinic, where you're just constantly exposed to people that are coming in with various illnesses, you're going to have a high increased risk of being exposed to the flu. They say people that should get the flu shot. Now, I know a lot of people question if they should even get the flu shot, but their general recommendations are anybody over 6 months should probably get a flu shot. Those people that live with people that are high risk, so like we said, any of those people that have increased risk of older age, really young, comorbidities, because in addition to if they get the flu, they can end up really sick. But if you get it and give it to them, even though your immune system can handle it, you might expose somebody else that might not be able to handle it. People that probably should not or really consider if they don't want to get the flu shot is if they have had an allergic reaction to the flu shot in the past. One of the main components of one of the main flu shots is eggs. So anyone that has an egg allergy, depending on how severe it is, you should usually, you know, talk to your health professional to see if it's something that is recommended for you. Some neurological diseases, if anybody's had any kind of paralysis from the flu shot, one of the main diseases, which is really rare, but people can get, is something called Guillain-Barré, which is ascending paralysis, meaning the weakness. Some people get the flu shot and they'll get weakness and numbness that start in their lower extremities and kind of progress up toward their main proximal torso area. So if you've ever had any kind of symptoms like that, those are people that probably should never receive the flu shot. Kind of like any disease, like we're saying during this whole coronavirus pandemic, prevention from viruses are pretty much the same despite the virus. So, you know, washing hands frequently, you know, covering your mouth when you're coughing or sneezing, avoiding touching your eyes, nose, and other people if you're feeling sick, and sharing like personal items for people that are sick is like a big thing to kind of help prevent the spread of the flu or other viruses. In general, people have heard most of the symptoms of the flu, whether it's, fever, headache, fatigue, cough, sore throat, runny nose, body aches, vomiting, diarrhea. You don't have to have all of these symptoms. You can have one or two, you can have a few of them. As people's immune systems is different, the severity of the symptoms might also be different. If you feel like you might have flu kind of symptoms, the best thing we say is like, try to, kind of like we're doing for COVID, is isolate yourself from other people. That way you kind of limit the spread of actual flu symptoms. When it comes to the flu vaccinations, there are a few different, there's, like I said, the egg mediated, there's cell mediated and recombinant. So there are different formulations for the flu vaccine, and the way that they usually come up with the flu vaccine, because the flu changes from year to year. It's not anything that's super static, so that's why there's a different vaccination every year, and it changes pretty frequently. So they usually will, at the end of the flu season, like when it comes to February and stuff, CDC and people will get together and determine what they think are the most common, like prevalent strains of the flu that will probably affect the next flu season. And based on that, that's how they kind of determine what's the flu vaccine that they're going to use for, the next year. When it comes to hospitalization, there's over like 200,000 a year, over like 36,000 deaths from the flu each year in the United States in general. And majority of the people that are going to suffer or die from the flu are over 65 years old. So it's very important, like we say, that the older population, or if we're exposing them to ourselves, that we try to keep them protected from the flu in general. When it comes to like the flu, there are, there's quadrivalent vaccine, there's tri, meaning there are two parts of influenza A, which is the more serious kind of flu. There's one part or two parts of influenza B that they mix together in order to make the flu shot. Now, there is also influenza C, but usually that's just like a mild symptom, so nobody really worries or cares about that. But A is the one that people really worry about. B, mild symptoms, people usually not as sick. But either one of them are going to make you feel horrible for some time. One of the questions, or a lot of times people will say when they get the flu shot, then they actually feel like they get the flu. The flu shot in general shouldn't really give people the flu, but you can get respiratory kind of symptoms. And once you get the actual vaccination, it actually takes like 4 or 5 days for your body to actually build up the immunity. So say if somebody was actually exposed to the flu a day before they actually got the shot, or 2 days, they might actually still get the flu and thinking that the flu shot actually made them sick. But outside the flu, then you still have the other coronaviruses, the other flu, cold viruses that could still make someone sick when they actually don't have the flu. So in general, the flu is very, contagious. It's very preventable with the flu shots. Just because someone gets the flu shot does not mean that they're not going to get the flu also. But it has been shown that when you do get the flu shot, your symptoms are milder than someone that doesn't get the flu shot. In addition, if you're hospitalized and you have to go ICU or just hospitalized, your stay course is actually shorter. And if you're in ICU, you're less likely to be in ICU and you're less likely to have a severe complication from the flu. So there are benefits to getting the flu shot, whether you get the flu or you don't get the flu. For the most part, that's just general information about the flu, that it is very recommended. I recommend it. Now I know it's a very personal decision for everybody if they want to get the flu shot or not, but you know, science and data has showed that it is very beneficial that even if you do get the flu, your symptoms will be less severe. People are less likely to, you know, get really sick and end up in the hospital from the flu. So I don't know if there's any questions in general about the flu shot or questions about the flu in general, but it's something that, you know, the CDC recommends, and I would recommend for everybody over 6, in addition to people that have any comorbidities over 50, unless you have had any like adverse reactions in the past to the flu, to AIDS, like some neurological symptoms, because it's pretty safe, low risk, and it definitely has more benefit to you and the population and the people that are living and surround you than, you know, the possible consequence of somebody getting really sick and possibly dying.
Thank you, Doc. I think we have several questions. I got a couple of questions that they sent me. So thank you for all the information and for everything that you brought us update. So we can start our questions. Jesus, do you see any questions in the questionnaire?
Not yet.
No. One of the questions that they sent me on a text was, I hardly ever get the flu, but everybody tells me that if I get the flu shot, I will get sick. What do you have to tell us about that?
Yeah, so like I was saying, people can get mild symptoms, you know, of, you know, fever, cold, congestion, but they don't actually have the flu, the actual flu. The other possibilities is, like I said, if they were exposed to the flu or another virus a day or two before they got the vaccination, they haven't had enough time to build up the immunity. But the benefits are, you might have mild fever, cough, chills, even from the shot, but it's not going to be the actual flu. It's still beneficial to the fact that if you get the real flu, you're probably going to end up way more ill and sick than just from the vaccine. I know nobody wants to feel ill, but it's kind of like how we've taken this pandemic with coronavirus, that people are not really concerned about it until it personally hits them or one of their families. And it's the same with the flu. People can say they don't want to get the flu shot and they don't believe in it until it personally hits them and their family. Then they, you know, second guess it when it may be too late. So.
Okay. So another question is, do we always get fever when we get some of the symptoms of the COVID? Or
No.
No.
So yeah, you don't always have to. Now fever is definitely one of the more common ones. Cough, shortness of breath, more common. But some people just get, you know, cough, congestion, shortness of breath. Some people will get body aches, nausea, vomiting, diarrhea without the actual fever. I've seen it multiple times where people will just come with cough and short breath. Right? They'll say that they've been exposed to other people that have like respiratory symptoms, or most of the time they don't even know where they got it, and they'll eventually come positive. A majority of people that do get the coronavirus or the flu are going to have mild symptoms. They might not feel that bad, except a little cough and body aches. Not most of them are going to end up going to the hospital because it's not going to affect them that much. But like we said, the general benefit to the whole population, when you have it and you can expose other people, when other people don't have the immune system like you to fight it off, that's when we get in trouble. You might be okay, but the people you expose might not have the same, luck that you did.
Okay. So thank you, doctor. So one of the other questions that I got, let me get the last one. It's more, so not everybody at a household can get it. Some of them can be positive and some of them can be negative. But
Correct.
How do we know, do we all get tested for that same reason in the household?
Yeah, so that's one of the questions that with the flu and a lot of viruses, even when this coronavirus started, like, does everybody need to be tested? if you don't have symptoms, you don't probably need to be tested unless you're at like with risk population. So if, like I said, you have somebody that has heart disease, diabetes, over 65, and you've been exposed, then it's reasonable for you to get tested, because a lot of people we know will be asymptomatic carriers. And like we were saying with COVID, that was anywhere from 2 to 14 days before sometimes people would have symptoms. So you could still spread it, even though if you're not coughing, you're less likely to spread it because it's usually airborne droplets. That even if you're not coughing, you're less likely, but you could still spread it. Even if you're not symptomatic, you could still pass it to somebody else that will have symptoms.
Okay. So, did any questions come up with Jesus?
I have one question. So it says, is there a difference between the flu vaccine and flu mist? What is the best recommendation for pediatrics?
So one more time, can you repeat the question?
Yeah, so it seems like it's two questions. So one of the questions is there any difference between the flu vaccine and flu mist? And then the second part is, what is the best recommendation for pediatrics?
So for pediatric, it's the same as all adults for the most part. They said, though the flu vaccine, I'll say in general, is approved for anybody over the age of 6 months. CDC recommends anybody less than 5 years old get the flu shot, only because, as you're getting older, your immune system is not, when you're young, your immune system is not as built up as when you're older. So kids will be, more susceptible to get these viruses. Now, kids usually bounce back easier, and their symptoms are usually less, more mild than adults. But yeah, they still recommend it. Now, the flu vaccine, there are different formulations of the flu vaccine. For the most part, we give everybody from 5 to 50 the same flu vaccine. As you get older, sometimes we'll give you like a less virulent, like the trivalent one, just because we still want to give you some protection, but your immune system might not be as strong.
Okay. I have another question, doctor. Where do we go to? What side do we go to see where they're giving the flu shots, or can we go to our own doctors?
Yeah, so the flu shot is very, you can go anywhere and get it. Any of the CVS Minute clinics has it. You can go to your regular doctor, they give it in the office. Even like Costco or Walmart, they even like sell the flu shots. It's pretty well common. Now, if you go to your doctor, usually they cover the flu shot and it's probably free. So if you have a doctor in a primary care, usually your insurance will cover it. You don't have to pay anything out of pocket. If you go somewhere else, they'll probably charge you for the flu shot.
Okay. Do we have any more questions, Jesus?
Not on my end.
Do we have, I have one, hold on, I just came in. Do you know where we can get a list of places where we can get the virus test?
For the COVID?
For the COVID.
So in terms of the regular community, I do not know in general, but I know you could probably find that on any government site. But I know any hospital, especially where I work, they have drive-through testing. A lot of the counties have set up drive-through tests. You probably have to look at the county health department to see exactly where you can go. But I know where I work at Kaiser, you usually just tell your doctor and they put an order in and you don't even have to go or get out of your car. They just have a drive-through, they swab your nose and you go.
Okay. So if anybody needs the link to see where they're getting the COVID testing, you can call me and we can have it for you. We can find a place for it. Do you have any more questions, Jesus?
No.
Doctor, so is it recommended to give it to everybody at the house, the flu shot? or just like the elderly? That's what it
Yeah,
is.
so it's recommended to give it to everybody. There's no real contraindications, like I said, unless you've had a bad reaction to the flu in the past. But in general, there is nobody that should not get the flu shot. Everybody over the age of 6 months can get it. It's pretty safe. It's not a bunch of data that shows any kind of major complications from it. Like I said, unless you're allergic to eggs, that's the only question. But I know a lot of people nowadays don't like to get vaccinated for personal reasons, but for every medical reason, everybody should get it.
So I have one more question. I don't know how it's gonna. They tell me that it's nothing but dangerous to get a flu shot. Why do people say not to go get a flu shot? Because you're getting injected with all these viruses. Is that true or false?
No, it's true. So usually, like, the flu shot is part of the virus, but it's not like the active parts of the virus. So usually when you have a virus, you have like the shell, but you have like the kind of like the DNA inside, which actually causes the major virus. So when we're giving the shot, we're just giving you some of the proteins on the shell. That way, our body can recognize if you get the real flu shot, that your body can mount a defense against it before it actually causes any real damage. So even though you're getting some parts of the virus, you're not getting any of the major parts that's actually going to cause the full blown out flu, right? But that's how any immunity works. Whether if you actually get the flu virus, your body gets really sick, but it's also going to produce immunity to it. So the thought of getting a vaccine is expose you to parts of it, but you're not going to get really sick. That way it can prevent you from needing to be hospitalized, being in the ICU, or getting to a point where you or expose someone else that could possibly die from the flu shot, you know what I mean, gets really sick. But for the most part, a majority of people that get the vaccination are not going to have any symptoms. Now, we always hear there are some people that get symptoms, but a majority, I got the flu shot already, and I've been fine. My family, my mom and stuff, like they've gotten the flu shot. They've been fine. They don't have any symptoms, but you're always going to hear 1 in a million people that say, I got the flu shot and it made me sick, which, like I said, it could be because they were already getting sick either way, or they have another virus that just mimics it.
So if you came out positive on the COVID testing, do you recommend to still go get the flu shot if you haven't got one?
Yeah, I do. Even though it's right, you can get the flu and you can get COVID. You can have both of them. Smaller risk, but then it is possible. The only reason we say if you're having a fever, actively at the time, then you should hold off getting the flu. So if you're positive for COVID, but your symptoms are pretty much resolved, yeah, get the flu shot. If you're just diagnosed with COVID and you're pretty sick right now, then that's the time you might want to wait and hold off getting the flu shot when you're actively, really sick from COVID. But if you're positive and like one of the asymptomatic people, you can go ahead and get the flu shot.
So I think one more question that came up is, can you tell us how you see the COVID-19 progress? Is it worse now than it was a month ago, or is it getting better?
So, I mean, that's like, it's hard. It's a little question. So a lot of states have been have been having a spike. So we were doing well. The numbers were going down. Percentage of, especially in California, Governor Newsom usually posts like the numbers every single day. But we were getting better. We started to hit a little spike again. But in terms of people actually being hospitalized and people needing to be in ICU and people actually coming to the hospital, those numbers are different. But the thought is, if we're starting to have a spike, then those numbers might start to increase in the next few weeks, especially with flu season. But as of right now, even though more people are positive, obviously we need to know more people are getting tested. Hospitalizations, ICU stays, those numbers are actually down. So we are doing better in terms of the severity and people needing to be hospitalized for COVID. But in the near future, those numbers might start to go back up as we're starting to hit another little spike.
This is my question. Do you think it's spiking up because people don't put masks on, or is it just because people are just going out and starting to do normal things that they were doing before, not taking care of people?
It's two-part. It's going up because people want to get back to their regular lives. People are tired of being stuck inside. People want to have some kind of normalcy where they can go out, enjoy their life, go eat, go hang out with family and friends, which is all understandable, because we are social beings and, humans are meant to interact with each other. So it's a combination of this being a very contagious virus, plus we are starting to get back out. Now saying that, what's the best route? Is it to close everything out again? I don't think anybody's gonna really want that or stand for that. Or as we're progressing, we just have to make sure everybody's being safe. People making sure they're wearing masks. If somebody's having a fever or cough, they stay home and stay isolated while they're getting a test. And if you have family members that are exposed and you've been possibly exposed, you get tested and you stay isolated too until you actually get a test back. So, right, you can also be asymptomatic, carrying. So it's going up because we're getting out more. We're getting back to work. We're exposed more. We're exposing others more. But at the same end, we know more about it. And we're trying to be safer in terms of how we're doing the social distancing, even at restaurants and, outdoor dining, to make sure we limit the risk. I think at this point, nobody wants to go back to quarantining the whole nation. So as we're just, progressing, we just have to be safe about, washing hands, wearing masks, and exposing others and ourselves. And if we're sick, you need to do the socially responsible thing and just keep yourself away from others that you can potentially infect.
So my question, what, in your opinion, or in your I guess what you're thinking or what you see in the hospital, I imagine, do you think it's going to get worse than what it is now, or okay?
I think that for the most part, I think more people are going to come to the hospital with COVID, but I think there's going to be less severity. So it's going to be like, we're going to have more people that come in positive, but most people are going to be able to go home. I don't think people are going to be as sick, only because we're taking more precaution to limit exposure to the higher risk population. So even if the numbers go up, I think less people are going to actually, percentage-wise, they're going to be coming in really, really sick from the COVID.
Do you think we're ever gonna, well, not ever, but I mean, do you think soon we're gonna get something to cure this, or is it just gonna take a longer time than we expect or that we're hoping?
I think it's probably going to take time. I think there's no one that can put a timetable on this. They are making vaccines, but in general, it takes 18 months in order for most vaccines to even be developed at a rush kind of speed. And let me see, February to now, it's been 8 months, right? So if we're saying 18 months, we have like a whole nother year probably before actually the vaccine might even possibly be a good one. And even if they make one, we don't even have any guarantee it's going to be a good vaccine, So it's one of those things, like, we can help, we can, pray that we find something that's going to, treat it well. Like, there are medications that do help with the symptoms, and the severity of the disease, but a cure probably no time soon, a vaccination probably no time soon either, probably till sometime next year.
Wow.
At the soonest.
Yeah, that's not what we wanted to hear, but I guess the truth is the truth, how it is. Oh, well, this was a lot of information. Jesus, do you have any more questions in your chat?
No, I don't.
Is there anything else that you would like to tell us that we can do to help all this that's happening?
Yeah, I mean, I just think, it's important to be safe, getting a vaccination. I'm one of those people that are for vaccinations. And I have nothing against people that don't want a vaccination. It's a personal decision, but if I had to say, follow the evidence and the science, it's perfectly safe to get a vaccination, especially the flu vaccine. But like I said, it's a personal decision, which if you ask any healthcare provider, most of us are gonna say, get the flu shot. Not saying that's 100%, because some health providers don't like the flu shot either, which is fine. But I would say in order to protect, the majority of people, us and them, our patients, our family members, that, when everybody does their part, it just kind of helps protect everybody in general.
To take care. So I know that I think you said 6 months for the babies are the recommendation for them to go get a flu shot. That was told us earlier.
Yeah, any kid over 6 months can get the flu shot, so it's totally fine.
Okay. That was one of the other questions that they just sent me. So this was a lot of good information. I really want to thank you for joining us and taking time to come and talk to us and give us an update of what your thoughts and what we should do. Is there anything else, anybody, Myra, Jesus, Yarali, want to ask that you guys would like to know before we keep going?
Just really quick, Josie, is there something that we need to know about the flu vaccine and pediatric population?
Not really. It's the same recommendations as with adults. So, like I said, just the ones that are having increased risk are less than 5 years old. Kind of like you say, anybody over 65 is at increased risk in people with comorbidities. But it's been approved, it's safe, like the CDC, for anybody over 6. So, same as we would do for a 5-year-old, as a 15-year-old, 20, 30, 40-year-old. It's all the same in terms of risk in terms of getting the flu shot. So they shouldn't worry about a 5-year-old versus a 30-year-old.
Thank you.
Thank you, Doctor.
Well, thank you very much for all the information. It was great to have you here and letting us know about the flu shot and how important it is for us to go and take this flu shot. Is there anything else that you want to tell us, Doctor? Anything that you recommend before we continue with and telling you thank you for all the information?
No, I think that is it. No, thank you for having me. I appreciate it.
Well, thank you very much. And is there any questions? I want to thank everybody, our audience, that came and joined us today. And if you guys have any questions, please feel free to email me or call me at the number. And we will have somebody new next week. And I just want to thank you again, Dr. Britton, to say how grateful we are to come, for you to take your time and come and tell us all this information and all this that we need to do to help all see how we can help and try to get rid of all this COVID and not get as sick as we are getting.
Yeah.
Thank you very much for all your help and for all your information. So,
Thank you for having me.
So we're gonna continue with any updates. Do you want to tell us about this takeout or?
So yeah, today is the Great California Shakeout. So if you aren't practicing it with your work or at school, you can still take time to practice your earthquake drill every year, October 15th, and you can go to shakeout.org to find more information. And there's actually an app that you can download. It's called the My Shake app, and it's for early earthquake warnings for earthquakes over 4.5. So you can go download it. It's for Android and iPhone. It's called the My Shake app.
Thank you, Yareli. Anybody else has anything else they want to talk about, announce? You guys can put, if you guys have anything going on, any information, you guys can put it in the chat and we'll make sure that it goes out to everybody that attended this webinar. I just wanted to continue telling you about, don't forget to go into our website and look at our new CCPL program that we're promoting out there and hoping that you guys join us. It is a very good program. It's a 15-month program that we are putting together. And it's through Healing Communities through Racial Justice. It's for any agency, business, organization that has never practiced that in their organization before or their agency. We are asking for people to come and attend all the 15 meetings. It's only 3 hours once a month. And we are giving stipends of $10,000 for everybody that shows up to all the meetings. And it's not for everybody. You can bring up to 3 people from your organization, but the $10,000 is for just the organization, for just one time, not for each person that attends. Sorry, I want to get that clear. But it's a very good program. It's you have to go and see what it's all about. It's how to teach and educate ourselves on more on just racial justice. Sorry. And then it goes back into your organization, how to implement it into your organization and how to hire people that are thinking this way. It's very, very interesting. It's a very good program. We have space for 10 people, 10 organizations right now, agencies or business. We are looking for more funding. We are waiting for funding to get more agencies, but we do have for 10 right now. So you have to go and apply for it. And then we are going to review them, and then we're going to pick 10 people or 10 organizations that are going to be able to benefit out of this. So I hope that you go into our website and look at it and join us if you are interested in this kind of work in your organization. I know we have anything else that you guys want to, Myra, do you have anything you want to announce? There's the link.
Not today, Jessie, but thank you.
Okay. Jesus, do you have anything else? We do have, Jesus, do you have anything else before I go again?
No, Josie.
Okay. I do want to ask you guys, if you guys want to go into our website or and look into our new trucks, the Volvo trucks that are coming, that came out in February. They're the new trucks, electric trucks. We had a big parade from Long Beach to San Pedro, and they announced all the trucks, everything, all the equipment that came out electric this year. It's very exciting to see how everything is coming up and trying to clean our environment. I do recommend for you guys to go and see it and learn a little bit more of all the trucks and the equipment that's coming out electric. We are going to be offering some classes at Honda College and San Bernardino Community College to learn how to work on these electric trucks and electric cars. They are asking for, it is a demand for people that, they are asking for people that go into these courses. It's a 2-year course, and people are hiring right now because we need a lot of the people that can come and help us fix these cars and trucks. So thank you very much, everybody. We are finishing a little bit early, and I apologize for all our little problems that we had with our webinar. and our computers. But I want to thank you, everybody, for attending and for joining us this week. Next week, we are having a very good speaker on how to help us with our loved ones that we are taking care at home that are disabled. So if you are interested in something like that, just I will send out the information tomorrow or Monday, the latest, so you can see more about who's coming up next week. Thank you very much. And I apologize, Dr. Shapiro was not able to attend again. They are very busy at the ER. He's been wanting to come on it, and it's been really hard for them because they are very, very busy in the ER in LA County. Thank you very much, and we hope to see you next week, and hope to hear from you guys. If you guys have any questions, please feel free to call me or email me and let me know. If you have any suggestions on what you guys want to see at our webinar, anything different that we have not put in to bring information, or if you guys want to come and tell them what you guys do for the communities. Thank you very much, and we'll see you next week. And you guys have a great, great weekend. Thank you.
Thank you.